In 2018, the World Health Organization estimated that there were over 800 million people around the world living with a diagnosable mental health condition. In the same year, millions more were living with symptoms of mental health issues, although not reaching the level of clinical diagnosis, caused them significant distress and impairment in daily functioning. In 2017, depression was the leading cause of disability around the world. Unfortunately, all of these mental health estimates were made worse during the COVID-19 pandemic. A recent study with thousands of people around the world showed that 30 to 42% of the population were experiencing significant symptoms of depression, anxiety, heightened stress, or disrupted sleep during the pandemic. The good news is that clinical scientists have been working on evidence-based psychological interventions that work very well to reduce symptoms of conditions such as depression and anxiety. The bad news is that only a very small minority of people who would benefit from these psychological interventions actually go on to hear about them, engage with them, or are able to access them in times of need. In this gap, the gap between the demand for effective psychological interventions and the barriers to engaging with and accessing them, lies my research program and the research program supported within the Depression, Cognition, and Culture Lab. My name is Dr. Shadi Beshai, and I am an associate professor in the Department of Psychology at the University of Regina and the registered clinical psychologist in the province of Saskatchewan. The work we do in the Depression, Cognition, and Culture Lab is focused on improving perceptions of, engagement with, and access to evidence-based psychological interventions for conditions such as depression and anxiety. In specific, the work I and others do in the lab focuses on improving perceptions of and promotion of evidence-based psychological interventions such as cognitive behavioral therapy and in specific mindfulness-based interventions. Second, the work we do in the lab focuses on adapting these interventions so that they are more culturally representative and appropriate among people of diverse backgrounds in our multicultural Canadian society. Finally, the work done in the lab also focuses on improving access to evidence-based psychological interventions, perhaps by transforming them into brief online modalities so that more people who need them can access them in times of need. I have been very fortunate and lucky to work with several bright and enthusiastic students at both the undergraduate and graduate levels. The work these students do is integral to the research we do in the lab, and the success the lab has enjoyed cannot have been had without these students. I look forward to many more years of supervising honors and graduate students who will undoubtedly be an important part in closing the intervention uptake gap in mental health. I look forward to working with you.